Well, welcome everyone. I know folks are still joining us, but it's one past the hour according to my clock, so I'm going to go ahead and get us started. My name is Christine Aronson, and I'm the director of the U.S. National Center for Interprofessional Practice and Education based at the University of Minnesota. And I'm really excited to be just kicking off and welcoming our speakers today. We're going to be talking about the American Interprofessional Health Collaborative and the where we have landed as a collaborative after
Thanks, Chris. And hello, everybody. I am Devin Nickol. I'm a general internist here at the University of Nebraska in the US. And along with Tina, we're the co-conveners for AIHC. And so thank you on behalf of us and on behalf of AIHC and the National Center for Interprofessional Practice and Education for letting us come and spend a little time with you here today. As Chris alluded to, AIHC has gone through a reorganization process recently, and we wanted to tell you a little bit about that and maybe give you some ideas as to how you might interface with AIHC in the future. And for some of you, certainly, if you're not members, it might be something you'd want to consider. But we thought we'd tell you a little bit about what's been going on with the organization here and the new structure, and give you a chance to hear from some of the people involved in the leadership of the various groups within AIHC. And then at the end, I think we'll have plenty of time for people to ask questions or kind of get to know folks here that maybe we're all meeting for the first time. So AIHC, as we went through our reorganization process here, identified that we would now have two co-conveners to serve as the leadership for the organization. And you can see Tina's picture up there. She is at LSU, and I am at the University of Nebraska Medical Center here in Omaha. And we are working with a whole lot of other folks in sort of a fancy new organizational structure here that we're all just coming to grips with. It's new to all of us. And so if we seem like we have to think for a minute when you ask questions, probably it's because we do. And we're getting used to these new terms a little bit also along with everybody else. But here is the graphic, I think, that probably sums up the structure the best for us here. And so you can see kind of the ring around the whole thing is the AIHC community of practice, which is all of us involved in health professions, education, and practice. And then within AIHC, you can see that we've established 4 collaboratives, a collaboration hub, and there are 2 committees. And so these are the things that we're all getting used to keeping track of here. And so the committees are the communication committee and the membership committee. And those are still called committees because they serve as sort of infrastructure and support for everything else that AIHC does. So you can see the communication committee up there at the top. They handle membership communication. And then the membership committee at the bottom, their job is to get members and engage with members and retain members and make sure that we're delivering value to our members and all those sorts of things too. So those 2 groups interface to a greater or lesser extent with all of the other collaboration or all the other collaboratives listed here at various times. And so the collaboratives are a reimagining of what used to be some of our committees. But we found that as an organization, we didn't always manage to communicate between our committees as well as we would have liked. And so there were a whole lot of kind of ad hoc processes for doing that sprang up over time that worked, I guess, but maybe weren't the most efficient way to ensure the flow of information back and forth and up and down and in every direction. And so the idea here is you can see in the middle, we have what we call the collaboration hub, which might sort of resemble an executive committee for other organizations. And the idea of this collaboration hub is it has membership, as I'll show you in a second, from the various collaboratives, and this group meets and makes sure that everyone's needs are getting met and that everyone's aware of what everyone else is doing and so on. So it's kind of the center, the hub of all the collaboratives here. And then around it, you can see the other 4 collaboratives, the Learning Collaborative, which organizes our learning opportunities for members, And then the Evidence Collaborative, which is kind of our scholarship group that looks at presentations and developing scholarly output for the organization. We have a Mentoring Collaborative, which focuses on mentorship of faculty and students and people at various stages of their careers and helps organize those opportunities. And then last but not least is the Innovating Collaborative, and their job is to come up with good ideas. So they are meant to come up and advance new initiatives within AIHC that will benefit our members and the organization as a whole. So these are the groups, and these are new by and large. It doesn't match our previous organizational structure really, but these were the areas that we thought we wanted to focus on as an organization. And I'll show you on the next slide here a little bit more about what they're supposed to do. And we don't have to read all of this, but the idea of this one is to talk about the primary responsibilities of each of these groups. And if you look at it, kind of summarizes what I said before, but the collaboration hub in the middle there is really meant to serve all of the other collaboratives and make sure that we do know what's going on and that people are in communication with each other and they know where the resources are within the organization and that we prioritize what we're working on and all those sorts of things. So that handles a lot of the day-to-day work of, or the day-to-day operations of AIHC. The actual work takes place within the collaboratives who advance each of the initiatives for the organization. So you can peruse this graphic later at your leisure and see all of the different aspects of each of these collaboratives and what they work on. And then in terms of membership for each of these units, if you look at the center there, the collaboration hub, that has the co-conveners, Tina and myself, and then 8 people that we are calling co-facilitators. Those are the leaders of each of the 4 collaboratives that are off on the side there. So each of them have 2 co-facilitators, and they are part of the collaboration hub. And then, so you can see them all listed there. We also have 2 representatives from each of the committees, communication and membership, who participate in the hub. And we have some folks from the National Center who make sure that we're doing a good job of interfacing with the National Center. And then we have a student representative and 2 community representatives also. So that's the hub. And then if you look at each of the collaboratives, their makeup is fairly similar. They are led by 2 co-facilitators, and then they have representatives from the other collaboratives who participate within that collaborative's meetings as well. And this was all designed, as I said kind of before, to enhance our communication across the organization, which was really an area that we had identified repeatedly needed some work. And this is our idea, at least, and we'll see how it goes. But the idea is to help make it so that it's hard not to communicate between these different groups from now on. And I suspect that this will get revised some as we move along and perfected. But this is our initial draft of how we're going to set all of these different units up. So AIHC, if you weren't aware, is the membership arm of the National Center of Interprofessional Practice and Education, and it has its website, aihc-us.org, and you can become a member. So if you are a member, there is a member-only area that you can visit on the website that has all sorts of special things, and that includes the calendar, which is an oft-asked question. How do I know when our meetings and so on are coming up? And there is a calendar there in the member area. There are also various documents that you can look at that have been posted there that talk about past meetings and so on. There are webcasts that we archive here. There's some information about members. There's some things like the one-pagers that our scholarship committee developed to help people pursue scholarship in interprofessional work. And so there are a whole lot of different goodies in here that you can browse through if you're a member. And so it's just kind of to make you aware that there is kind of a special member section here within the AIHC website. And for those of you who are members or might wonder what's coming up within AIHC in the future here, we have several all-member meetings. And those are coming up in December, March, and June here. We have a social hour coming up on October 24th. And you can register within the AIHC membership portal by going to the member link there, which is on the right side of the screen. So if you are a member of AIHC, you can go in there and get your account set up so that you can access all of that member-specific content too. And if you're not yet a member and you think you'd like to be one, here is some information that might be helpful to you. An annual membership is $150 for a full membership. We also offer student and institutional memberships. You can see there. So there's a reduced rate of $30 for students, and you can get basically 5 for 4 memberships at the institutional level. So you could have 5 folks from your neck of the woods join for $600 and get a whole bunch of people signed up at once. And so various membership options. And if you have questions about any of that, please feel free to reach out to us. But it's just to let you know that there are various options available to folks for joining AIHC. And it's done on, it's an annual basis. So you can see there that memberships last from whenever you sign up, or July 1st until June 30th of that year. And I believe we prorate the membership rate, by the way, if you're wondering about that too, if you sign up later. So that's a little bit about just the kind of the nuts and bolts of the structure of AIHC. And we have some folks who joined us here today who are going to tell us a little bit more about their neck of the woods within AIHC. And we'll kind of go from one to the other. And I think Tina's going to help pass that baton along from person to person. But first up, we have Angela Cecil, who's here representing the membership committee. So if you remember from that graphic, we have 2 committees, membership and communications. And so Angela represents membership. And Angela, if you want to tell us a little bit about the membership committee here, we'd love to hear from you.
Absolutely. Thank you so much, Devin, for the great overview of AIHC and its new structure, and kind of hitting lots of stuff in a short amount of time. So thank you for this opportunity. So I'm Angela Cecil, and I'm one of the 2 co-facilitators for the membership committee with AIHC. My co-facilitator partner in crime is Kelly Carpa, and she couldn't be with us today, but so I'm representing the spirit of her and then myself as well. And then our committee wouldn't be a committee without other people. So I want to take a second to represent those who are current members or leaders within our committee. So we have Kelly Carpa, of course, the co-facilitator, Amber King, Kimberly Barron-Shepler, Dan Ferguson, Terry Fowler, Gina Baugh, and Aaron Breitenbach. So these individuals have decided to take some of the lead charges within our committee to help with the communication across all the different collaboratives and committees to help facilitate clearer messages within our organization that our members get to enjoy. And then a couple of folks have chosen to be members at large who will jump in and help us out with different things as needed. And so my purpose for sharing this with you is in the event that you'd like a way to become active in AIHC and you happen to have a heart for membership and recruiting folks and keeping folks engaged and enjoying the benefits of AIHC, perhaps consider partnering with the the communications committee. I know they'd love it, but in this case, the membership committee as well. And we would love to have you as a part of our team. We have a couple of folks who've expressed interest already. We'll be reaching out to you soon. But I want to mention also sort of like a current strategy that we have with regards to our recruitment and retention is specific to membership diversity. And so diversity of persons, diversity of professions, diversity of different parts where we are in our lives and our career. And so everything from students who are trying to recruit in to be a part of AIHC and early interprofessional catalysts and future leaders, as well as professional individual members, and then also the institutional members, as Devin nicely mentioned earlier. So if you are interested in sort of getting into AIHC, you're not maybe a member yet, but you're interested in just learning a little bit more or seeing who's a part of it, we do have the social hour that's tomorrow, and I'll be facilitating it. And then you'll hopefully saw the link that was posted in the chat, and I could repost it again. Just RSVP and hop on between 3 and 4 tomorrow Central Time, and hopefully you'll meet a few more maybe colleagues you've known for a while or haven't seen in a while, or maybe even meet some new colleagues, because as important as interprofessional education and collaboration is interprofessional socialization. So hopefully we'll get to see you there. And I will, if you have any questions, please feel free to pass them along this way. Otherwise, I will pass it to the next person in the queue. So thank you very much.
Thanks, Angela. So the next person who will be speaking is Kaisa, representing our mentoring collaborative. Kaisa.
Hello, welcome everyone. I am Kaisa Suboya, and I am one of the co-facilitators for the Mentoring Collaborative along with Dusty. And we are Sorry, I just came from a meeting too, so I'm a little bit flustered. So we are really looking forward to being able to do a lot more with this collaborative hub. It's really a pulled together effort coming from some of the leadership aspects of the former AIHC, as well as the mentoring program is now underneath this mentoring collaborative hub as well. So we are really excited to be able to not only have opportunities for people that see themselves as leaders within the IP world, if that's in academia or if that's in other capacities. And then we also have the mentoring program, which is pairing mentors and mentees, primarily within academia as they work on projects related to interprofessional practice and education. So we have a number of meetings, both within the larger hub and then within the two working groups that were previously, thank you, the leadership working group and the mentoring program working group. I was brought on in the middle of all this transition too, so all the names elude me from previously. But we would love if there are individuals that are interested in participating in more of the leadership aspect of that hub, as well as wanting to participate in any of the initiatives that we are working on as part of the collaborative.
Thanks, Kaisa. We appreciate it. So, and like Devin said, echoing all around, we are getting used to the new terminology of our reorganizational structure. So the next person representing the Innovating Collaborative, which is a completely new collaborative or area for the AIHC, is Bethany Robertson. Bethany?
Hi there. Can y'all hear me okay? Yep.
Yes.
Okay. I'm having a total lag with my Zoom today, so I think I'm a little behind what y'all could probably see in here. But yes, my name is Bethany Robertson, and I have been a member of AIHC for, gosh, I've lost count, but I was a former committee member of the scholarship committee, and was delighted when I was asked if I'd be interested in co-facilitating this new committee. I like to do new things. I like to start new things, and that's really at the crux of this hub. And I am co-leading this with Heather Mislis, who couldn't be here with us today. But we're just getting started, so I don't have a whole bunch to report other than what Devin really shared about, the title really suits it. It's innovating, so we're trying to innovate and focus on new things and collaborate. I see us as a bridge builder between communities, between educators, practitioners, as well as very excited about the global connection that will live within our group as well. So I think we're still looking for people that would like to be involved. And if new things don't scare you, then give us a shout. We'd love to consider having a few more members.
Thank you, Bethany. And as everyone who's on this call, we recognize you're not all from the United States. And so AIHC membership might not be an opportunity for you at this point in time. However, please know that working with Interprofessional.global is a core function of AIHC. And we also will have opportunities. I'm not sure if there's social hours or membership hours or whatever we might call them, but we will have opportunities for engagement that are not just for AIHC members. We did that previously before, and we will continue that in the future, but just give us a few months to get all organized. We just had our first meeting actually this month as a new collaboration hub. So the next speaker will be Erin Breitenbach, and she is representing the Learning Collaborative, which is also one of our new collaboratives. Erin?
Yeah, hi, I'm Erin Breitenbach. I apologize for not being able to share my screen. I'm nursing a hamstring issue, so I'm sitting on my floor. So anyway, the Learning Collaborative is, as Tina just mentioned, new. So we are really still building up our game here. In fact, I think we currently still only have co-facilitators. So that's myself and Shalene Thomas. I do not see Shalene here on this call. So other than that, other than us, I guess our recruiting, we need working group leads. We need a couple of team leaders. I think we're still deciding on or the communications committee is still deciding on a representative. The membership committee is still deciding on a representative, and we're kind of still working through that. And the way I understand it, we will be working on the various initiatives having to do with learning opportunities, such as the Collaborating Across Borders conference. We'll be collaborating with the National Center to work on that. The Nexus Summit, of course, that is the National Center annual conference. The master calendar of events, developing any new initiatives and various programming opportunities for the collaboratives. And so that's kind of all I have to report right now. We have not technically begun meeting as a group of two, and hopefully it will quickly become a group of more than two as people join in on this effort that the Learning Collaborative is going to be.
Thanks, Erin. And I think I will echo what you will probably hear from a lot of our representatives, and of course, Devin and I as well, is that this is a new structure for us. And so we're trying to understand as well where everything fits. It's nice to say where we think it will fit, but as we have conversations, we are willing to mold in what works best for the AIHC and our community of practice. And so the next person I'm going to hand it off to is Jenny Jessen, who represents our Evidence Collaborative, which is, I will type it in, instead of typing it in, Jenny, I'll just go ahead and say it. But the Evidence Collaborative will have some of the work that was previously done by the Scholarship Committee, but also new initiatives. So Jenny.
Thank you so much. Yes, Jenny Jessen. I'm at Creighton University. I'm the executive director of CIPER, which is our Center for Interprofessional Practice Education and Research. And I'm new in a co-facilitator role. I am leading this with Alexa Valentino. So she's my other co-facilitator for the Evidence Collaborative. And we have just started meeting. Like Tina mentioned, we're an amalgamation of what was formerly Scholarship, the affiliate conferences working group. So those are going to be absorbed. Our primary responsibility is advancing scholarship and interprofessional practice and education. And we have a few things that we're working toward. One, development resources and looking at disseminating research articles, toolkits, webinars, other educational materials for information exchange. Another is collaborative research registry, working on sharing those insights and best practices and resources, working with other collaboratives and committees to make sure that everyone's aware of the resource and actively using it. And then the third is certifying affiliate conferences, which was work was done previously, just making sure there's quality and alignment with our mission for that certification process. We're also in need of working group leads. If scholarship is something you're drawn to, please reach out to one of us. We'd be happy to have team members with us as we move forward. And yeah, we're just getting started. We're working on our to-do list and our calendar, and we're excited. Thank you so much.
Thank you, Jenny. And so the last person we will introduce today before we have an open Q&A session is Gina Baugh, and she is a co-facilitator of our communications committee. So Gina, take it over.
Yes, good afternoon, everyone. I'm Gina Baugh. I am a pharmacist by training, and I'm the director of interprofessional education at West Virginia University in Morgantown, West Virginia. I have been fortunate to serve in the role on the communications committee here. I helped to lead it last year, so I'm excited to be transitioning into this new format for AIHC and into the co-facilitator role. And I love the fact that the communications committee now has a representative on all of the different hubs, because one of the most challenging parts of the communications committee is keeping up with all of the work that's happening within all the different groups within AIHC. So with the new structure, our group will have a representative on each of those different hubs. So we hope to increase our presence and our communication and work collaboratively with Angela and her group on membership to really, work together to make sure others know what's happening within AIHC and communicating that effectively as we increase our membership. So if you're interested in communications, we have a pretty nice group right now, but we can always welcome more, because the more folks we have working with us, the more we can do. We're hoping to increase our social media presence this year. Make sure we continue to provide a newsletter for our membership to highlight the accomplishments of all of our AIHC members. So please don't hesitate to reach out if you're interested in working with us. And also please be on the lookout for when we send out communications, and make sure you share your accolades and accomplishments whenever we put the call out for those. So thanks, everyone. I look forward to getting to work with many of you.
Thank you, Gina. And I think that was our last representative speaking from AIHC. And so I want to thank everyone, first of all, for being here, whether you're a member of AIHC or you're a member of Interprofessional.global, welcome. And so we'll open it up to any questions and answers that you might have. I think I may have failed to introduce myself. My name is Tina Gunaldo, and I am a co-convener with Devin, Nickol, representing the AIHC.
And since we are in presentation mode of Zoom here, you can either type a question into the chat, or I believe just unmute yourself and yell at us. That would be okay too.
Absolutely. There's silence, so I'll just say something that might spur some conversation. I'm not quite sure. But I think going through this transition of reorganizational structure will take us time. But the AIHC had many great initiatives prior to this restructuring, and this restructuring has been 3 years in progress. And so for anyone who's on here, you've probably been a part of some type of conversation, focus group, task force committee related to AIHC if you are from the United States. And then for everyone else who's not from the United States, maybe there's some opportunities, or I know there are some opportunities that we can share and learn together in regards to our structures for our community of practice. And so would anyone like to unmute themselves and talk about how they maintain communication within their regional or their country's IPE or IPCP structure or association? And I will say maybe not, but this is one of the areas that I think is important. And I think it was important for us to be transparent with AIHC members, and that this is an area that we could improve. We talk about it quite often with our students, right? And with the clinicians that we work with. So communication is one of those top priorities. It's one of the 4 competencies within the Interprofessional Education Collaborative. And so we really need to walk what we're talking about. And it is the most difficult piece. So I see Moni, thank you so much for raising your hand. Go ahead and unmute yourself.
Trying to be collaborative here in silence. There's a few of us from the Canadian Interprofessional Health Collaborative here on the line. And so I can comment a little bit about what we've tried to do around communications. So from the CHC board, there is a communications committee, and there's also a community of practice committee, and we're supposed to be working very closely, so we try. But a number of years ago, and I can take no credit for this, a speaker series was developed called Collaboration a la carte Speaker Series. The majority of them have been in English. There've been a few en français because of our Canadian context. And we've tried morphing that presentation so it's not so much of a lecture, but creates an opportunity to communicate and network among the members across the country. And so we have what used to be primarily a didactic lecture for an hour. Now we try to limit it to maybe half an hour, then a Q&A for half an hour, and then members are invited to stay on for an additional 30 minutes. Not everybody can. So this is from the 60 to the 90-minute mark for an informal discussion to talk about what they heard during the presentation and how they might apply it to their own setting, whether it might be administration, regulation, education, whatever it might be. The feedback has been that it's a really good try. It's a good idea. Can't do it too often. Not everybody has 90 minutes. We schedule them. We aim to do it once a month, not always successfully, but sometimes it's been more than once a month. The number of people who attend can vary between 5 and 25. So depending on the topic, we have tried to make one of the sessions to be open to non-members so that we can also use it as a recruitment tool and communicate again, on the topic of communication, communicating it broadly that we are there and that we have this community, that we're trying to network, that we're trying to support one another. And so mixed results, it's still in the process. And it was only last year that we really started promoting this additional 30 minutes as an informal discussion and networking opportunity. So if that's what you mean by communication, it certainly does provide a platform for us to try to get the membership together outside of conferences, but on a monthly basis. It's often the same people who attend. And then the recordings are on our website so that people who can't attend also hopefully have the feeling like they're communicating, even if it's asynchronously. But I think it's a great way to try. And since we're so comfortable with Zoom these days, it is that opportunity. The take up of it is not as high as we would like so far, but it's in process. So that's what we've tried to do in Canada anyway, from our Canadian Interprofessional Health Collaborative perspective.
Thanks for sharing. That's wonderful. I think we can all learn from one another, right? 60 versus 90 minutes, providing information versus more of sharing. And what do our members want? Because I think, that's an echo for I think for either what we would call AIHC all member meetings or social hours. It would be interesting, and not putting Angela or Gina on the spot. Maybe it's more of Angela, but in terms of recognizing, is it the same people that attend, or do we see a variety based on topic? Oh, and Angela had meeting. Sorry.
I would just add, originally our idea was that you have a large group of people, and then you could do these breakout rooms in the last 60 to 90 minute mark based on interest, whether it's regulation, administration, education. But in the end, we found that people didn't want to go into breakout rooms when there was that critical mass. They wanted to stay together. Maybe it's FOMO, fear of missing out. Everybody wanted to hear what everybody else had to contribute. But people who do join, they want to stick in there and hear what everybody has to say and have that conversation, which is great, which is what we're trying to do, right?
Yes, thank you for sharing. Ashley, I see that your hand is raised. Do you want to go ahead and unmute yourself?
Hi, yes, I just want to say thank you for all the wonderful updates. I'm very new in learning about this organization. I'm currently a pharmacist at Texas Tech University Health Science Center, and recently became our School of Pharmacy's IPE director. Of course, I always had a passion for IPE, and I was just hearing about all the great committees and how there's opportunity to get involved. And I would just love to know, like, who might be the best person to maybe reach out to start getting maybe more involved.
That's a great question, Ashley. And so let's see, if you want to place your email in the chat, then I will send it to Angela, our membership committee co-facilitator, her and Kelly Carpa, and then they can reach out to you.
That'd be great. Thank you so much.
Okay, perfect. And thank you for your interest. And just for anyone else who is on the call who is interested in AIHC or is a member, we've asked all of our collaboratives and our committees to come to our November meeting with any openings that they have within their committees or their work groups or their team leads or representatives. And so sometime between Thanksgiving and Christmas, which I know is a hectic time of the year here in the United States, but during that holiday season, AIHC will probably send out some type of communication asking for interest in serving. And I got your email address. Thanks, Ashley. Anyone else would like to share? Devin, is there anything else you would like to say in conclusion?
I think that was mostly it. I was a little bit remiss earlier when I was showing you the organizational structure and that I didn't highlight the IP.global interface there in the I believe it's the innovations committee, and so I apologize for that. But we do welcome having representation from IP.global there.
Perfect.
But otherwise, yep. Oh. Thanks everybody for letting us come chat with you here. And certainly, if you have any questions about AIHC at any time, feel free to reach out to me or to Tina or to anyone else in the organization, and we'd love to get you involved or get you whatever information you need.
Thank you, Chris. Anything in conclusion?
No, I just want to thank everybody for joining us. For those of you who are going to Doha to All Together Better Health in a couple of weeks, have a wonderful time there. And thank you all for joining us today.
Thank you. Bye.